Good evening. My name is Josh, and I'll be your conference operator. At this time, I would like to welcome everyone to the NHSC Loan Repayment Webinar. All lines have been placed on mute to prevent any background noise. After the speaker's remarks, there will be a question and answer session. If you'd like to ask a question during this time, simply press star followed by the number 1 on your telephone keypad. To withdraw your question, press the pound key. Thank you, and I'll turn the conference over to Diane Fabi-King.
Thank you so much. Good evening. Thank you for joining us for the National Health Service Corps Loan Repayment Program Guidelines webinar. Tonight you'll hear from myself as well as Aisha Faria, Habiba Lomax, and Gary Halady. The goal of tonight's webinar is to help you understand the program requirements in order to successfully complete your service. We're trying to give you need-to-know information, some tools and resources that you can share. During the webinar, we encourage you to participate by asking questions. You may ask questions online, and our speakers will respond at an appropriate point during the presentation. If you'd like to submit a question, you may type into the chat box that's located on the right side of your screen. In addition, you'll be able to go through the online audio call and ask a question according to the operator's information for coming through that phone line. And more importantly, we'd like to make sure that at the end of the presentation, you also participate in our evaluation. We really appreciate you taking some minutes to fill out the form that will come up on the screen at the very end, because we do want to improve and continue to improve all of our future sessions. So again, we thank you for joining us, and we hope you find tonight's webinar helpful. I think I've gone over the session objectives, providing an overview of the NHSC Loan Repayment Program, and also about continuation contracts, as well as information about our Division of Regional Operations. We're also going to try to give you those need-to-know information tools and resources for your completion and introduce you to some of the NHSC service support team members. So let's talk about our key partnerships and our service guidelines. Well, as you know, you've signed the NHSC LRP contract, and this has provided you an opportunity to serve as a full-time or half-time clinical service at an approved NHSC member site. As an NHSC provider, you'll receive your salary and benefits from your practice site. However, your employment compensation package is completely negotiated by yourself and that NHSC site. When we talk about our partnerships and our benefits, we think about, of course, what are the benefits to our providers? Well, we believe at the NHSC that one of the most important benefits is the rewarding life experience that you will have in providing health care to those who would not have received it. And of course, in addition, service awards are up to $60,000 for 2 years of primary care based on the participant's outstanding balance of qualifying educational loans. And then again, you have some additional perks that we provide for our membership, which is access to free CEUs, NHSC newsletter, networking events, trainings, and of course clinical webinars that are designed specifically for our NHSC member providers. Sometimes we want to talk to you about what do you think the benefit would be for those who are actually at the sites. Our NHSC facilities do have benefits by having you come to their site or already located there. They get an opportunity to have providers of excellence. They find this as a great pool of providers that they can have to help sustain their organization in the communities that they serve in. And there's no additional money needed from the site to hire a recruiting agency to access a loan repayer. Loan repayers are right there. There's no need to have any money spent for any further recruiting. And of course, they reduce time away from the site because we provide opportunities for you to receive your program information and participate in CME sessions. So when you come to a webinar or if you come to a networking event, we try to make it so that it doesn't affect or impact the site itself. So those are great benefits for our site. We have 3 essential contracts: the NHSC LRP contract between yourself and the NHSC, the employment contract, again, which I indicated you have negotiated with your site, and of course the site application contract. This is the contract from our facilities that is between ourselves and the site to actually keep you in place at an NHSC approved site. We believe that these 3 key partnerships really are the basis of our organization. They make for a great triumphant, as we like to call it. The National Service Corps could not be what it is without our NHSC member providers who could not serve unless we had approved NHSC clinical practice sites. So, where do you practice? We do assist providers in finding clinical practice opportunities in the areas of greatest need. Healthcare professionals are providing outpatient primary health care services to populations that are in our health professional shortage areas that are known as HPSAs throughout the country. Traditional NHSC sites do include federally qualified health centers, outpatient clinics, certified rural health clinics, critical access hospitals, and FQHC lookalikes. Federal sites that serve our underserved communities also include the Bureau of Prisons, Immigration and Customs Enforcement, and Indian Health Service. I do want to mention that federal sites that are not included in this list of federal sites would be veteran hospitals. So we want to make sure you're aware of that. The federally qualified lookalike sites do actually meet our VPHC criteria for funding under Section 330, but they do not actually receive that funding in the sense that they meet all the criteria and qualifications but don't receive the additional monies. Community health centers are a category of an FQHC, and other types that are listed under that include healthcare for the homeless and migrant health centers. So, what are your service requirements? I'm sure all of you are asking that question. And as you know, licensure and certification requirements are required to be maintained with a professional license or certificate in your discipline or specialty in the state where you intend to practice. Additional requirements and or exceptions apply to awardees who match to a federal position: psychiatric nurse specialists, health service psychologists, clinical social workers, marriage and family therapists, and licensed professional counselors. Full-time and half-time clinical practice. Each of you is signed a contract for either full-time or half-time at an approved NHSC member site in your discipline and specialty for which you were awarded the LRP contract. You do have a practice agreement that was created for your files here at NHSC to specify the individual arrangements that you had between you and your NHSC approved site that is regarding your employment, but it is again not your employment contract. It does list the names of the approved NHSC practice sites that you will be working in, and it will note the start and end dates of your service commitment. So I'm going to turn this over to Aisha Faria so she can take us from here. Aisha?
Sure. Good day, everyone, and thank you for joining the call. My name is Aisha Faria. I'm a team lead in the Division of Program Operations Customer Service Branch. My division is primarily responsible for monitoring your in-service experiences, from ensuring that you're completing your in-service verifications to receiving and reviewing and processing your service requests such as transfers, suspensions, additional site requests, or simply to answer questions that you may have about your service obligation. So as Diane mentioned earlier, I'll be talking to you today about your service requirements. I'll be talking also about the customer service portal as well as the in-service verifications and service requests. There's a lot of information that I'm going to be sharing today, and all of this information can be found in the application program guidance, I promise. I'll try to be succinct in my description of your service requirements and definitely will be available to answer questions after we have presented. And I will also provide you the website address where you can find the application program guidance at the end of my presentation. So full-time service requirements, and I know that we've already gotten a question about this. For the purposes of your National Health Service Corps service commitment, full-time service is defined as working a minimum of 40 hours per week. So if you've signed up for a full-time service commitment and you are a medical doctor, a nurse practitioner, a physician assistant, a non-pediatric dentist, or a dental hygienist, you must work a minimum of 40 hours a week. Of those 40 hours, you must spend at least 32 hours providing direct patient care at your approved site. And of course, your approved site must be an outpatient setting. The remaining 8 hours of that week can be, but is not a must, can be spent providing clinical services, teaching, and or performing practice-related administrative activities. So if you wanted to perform your full 40 hours required for the National Health Service Corps, providing direct patient care, you may do so. Teaching or doing administrative activities for the National Health Service Corps is not a required activity for the National Health Service Corps, although it might be required by your site to do. So I just wanted to clarify that. For the purpose of the National Health Service Corps credit, you cannot exceed 8 hours a week performing clinical services or teaching activities and admin work. So all of these things combined cannot exceed 8 hours per week. So you're trying to hit 32 hours, at least 32 hours a week with direct patient care, and the remaining 8 hours can be performed. You can perform clinical services or teaching activities and admin work combined. And sorry for repeating, but I just wanted to be clear about that. So let's talk about OBGYNs, family medicine physicians who practice obstetrics on a regular basis, providers of geriatric services, and certified nurse midwives, as well as pediatric dentists. You may work a minimum of 40 hours a week, or you must work a minimum of 40 hours a week, I should say. And of those 40 hours, you must spend at least 21 of those hours providing direct patient care at your approved site. The remaining 19 hours of that week can be spent providing clinical services for patients in alternative sites as directed by your assigned site. Of these 19 hours, you can spend 8 hours or less teaching and performing practice-related administrative activities. And in this case, you cannot exceed 8 hours a week performing teaching activities and performing admin work. So these two things combined, you cannot exceed 8 hours of doing that. Of course, your site may have you doing these things for 10 hours, but for the purposes of the National Health Service Corps credit that you want to receive, we cannot give you service credit for performing more than 8 hours of these kinds of activities. The exception here, though, is if you are performing teaching activities in a teaching health center, in a HRSA-funded teaching health center, you cannot exceed 20 hours. So you can go up to 20 hours in teaching activities if you are teaching at a HRSA-funded teaching health center. A few more important things to note for full-time service with the National Health Service Corps. You must work 40 hours a week for a minimum of 45 weeks per service year. The 40 hours per week may be compressed into no less than 4 days per week. No more than 12 hours of work may be performed in any 24-hour period. Time spent on call does not count toward the 40-hour week. Hours worked over the required 40 hours per week cannot be applied to any other week. And you have 35 days of allowable absences per service year. These absences include all time you spend away from your site that prevents you from working the required 40 hours a week. This includes vacation days, sick days, holidays, continuing professional education, or any other reason. Now I'll talk a little bit about half-time service requirements. For the purposes of your National Health Service Corps service commitment, half-time service is defined as working a minimum of 20 hours per week. If you have signed up for a half-time service commitment, you are a medical doctor, nurse practitioner, a physician assistant, a non-pediatric dentist, or a dental hygienist, you must work a minimum of 20 hours a week. Of your 20 hours, you must spend at least 16 hours providing direct patient care at your approved site, which must be an outpatient setting, of course. The remaining 4 hours of that week can be spent providing clinical services, teaching, and/or practice-related administrative activities. Time spent providing clinical services, teaching, or performing administrative work, all of these combined, should not exceed 4 hours per week. If you have signed up for a half-time service commitment and you are an OBGYN, a family medicine physician who practices obstetrics on a regular basis, a provider of geriatric services, a certified nurse midwife, or a pediatric dentist, you must work a minimum of 20 hours a week. Of the 20 hours a week, you must spend at least 11 hours providing direct patient care at your approved site. The remaining hours of that week can be spent providing clinical services for patients in alternative sites as directed by your assigned site. Of these 9 hours, no more than 4 hours can be spent on teaching activities and performing practice-related administrative activities. A few more important things to note for half-time service with the National Health Service Corps. You must work a minimum of 20 hours per week, but not exceed 39 hours per week, for a minimum of 45 weeks per service year. The 20 hours per week may be compressed into no less than 2 days per week. More than 12 hours of work may be No more than 12 hours of work may be performed in any 24-hour period. Time spent on call does not count toward the 20-hour week. Hours worked over the required 20 hours per week cannot be applied to any other week. You have 35 days of allowable absences per service year. These absences include all time you spend away from your site that prevents you from working the required 20 hours a week, including vacation days, sick days, holidays, continuing professional education, or any other reason. Now I'm going to talk about your service requirements if you are working at a critical access hospital. A critical access hospital is a nonprofit facility that is located in a state that has established with the Centers for Medicare and Medicaid Services, or CMS as I'll call it, a Medicare Rural Hospital Flexibility Program, has been designated by the state as a critical access hospital, is certified by the CMS as a critical access hospital, and in compliance with all applicable critical access hospital conditions of participation. Only physicians, psychiatrists, physician assistants, nurse practitioners, and certified nurse midwives may serve at critical access hospitals for the National Health Service Corps program. If you have signed up for a full-time commitment at a critical access hospital, you must work a minimum of 40 hours a week. At least 16 of the 40 hours must be spent providing direct patient care at the approved critical access hospital outpatient ambulatory care setting. The remaining 24 hours can be spent providing direct patient care, teaching or performing practice-related administrative duties in the critical access hospital's skilled nursing facility or swing bed unit. Administrative duties cannot exceed 8 hours a week. Teaching cannot exceed 8 hours a week unless the teaching takes place in a HRSA-funded teaching health center. In this case, teaching cannot exceed 20 hours per week. If you have signed up for a half-time commitment at a critical access hospital, you must work a minimum of 20 hours a week. At least 8 of the 20 hours must be spent providing direct patient care at the critical access hospital outpatient ambulatory care setting. The remaining 12 hours can be spent providing direct patient care, teaching, or performing practice-related administrative duties in the critical access hospital's skilled nursing facility or swing bed unit. Administrative duties cannot exceed 4 hours a week. Teaching cannot exceed 4 hours a week. And because I mentioned teaching activities so many times, it begs the question, what do you define as teaching activities? So for the purposes of the National Health Service Corps program, teaching activities to qualify as clinical practice require you to provide clinical education to students and residents in their area of expertise. All teaching must be conducted at a National Health Service Corps approved service site. And the clinical education may be conducted as part of an accredited clinical training program. It may include the clinical supervision of students, residents that is required in order for that student resident to receive or maintain a health profession license under state law, or include mentoring that is conducted as part of the student resident experiences and rotations and community health search program, the Health Careers Opportunity Program, or the Center of Excellence Program. And again, I just want to reiterate that teaching activities are not required for your National Health Service Corps service obligation. The reason why we have introduced teaching activities or admin activities is because you work in the real world. Your sites are going to probably want you to do these things, and we want you to have some flexibility in completing your National Health Service Corps service commitment to do some of these things. So again, while they're not required, you can do these things under the guidelines that I just presented. And one other thing about teaching activities, if you're providing the service while a student or student-resident observes you, the time should be counted as direct clinical care, because at that point you're not teaching, well, you're teaching in a sense, but you're not teaching, you're treating a patient, so that can be counted as direct patient care. Next, I'll talk to you about our customer service portal. The online customer service portal is an electronic web-based customer service system that can be accessed anywhere via the web at www.nhsc.hrsa.gov. If you don't remember anything else about this presentation, I just want you to remember what I'm about to tell you about the customer service portal, because you will need it to access pretty much everything about your service obligation. It will also help you to get the answers you need to questions that you may have about your service. And if you currently do not have a customer service portal account, please log on to the website www.nhsc.hrsa.gov to create one. The customer service portal is a service available to you 24 hours a day, 7 days a week, and allows you to contact us at your convenience. The thing is that we only work Monday through Fridays, so we aim to respond to your inquiries posed in the customer service portal no later than 2 business days from your submission, and that's what we aim to do, and hopefully we can meet that objective. The customer service portal serves as the central location for you to access information and submit information related to your National Health Service Corps service. In the customer service portal, you will be able to complete in-service verifications, submit service requests such as adding additional sites, reassignments, transfer requests, medical suspensions, and half-time conversions. You will also be able to submit inquiries regarding your National Health Service Corps service and update your contact information and view your contract information, including your estimated end date. The in-service verification that I keep talking about, this is probably one of the most important aspects of allowing you to let us know that you are completing your time. It's a tool used by us to verify your service commitment. And your in-service verification must be current and reflect the National Health Service Corps sites where you are approved to complete your National Health Service Corps obligation. The site that appears on your in-service verification is the site that you are awarded, and if this information is correct on your incorrect on your in-service verification, you will need to let us know immediately. As mentioned previously, you are allowed up to 35 work days per service year. I see there are a few questions about that out there on the chat, away from your assigned site. If you exceed 35 absences in a service year, your obligation end date will be recalculated and extended workday for workday. In verifying your service, you will enter any time spent away from your National Health Service Corps approved site during regularly scheduled work hours that takes you below your required number of hours that you are supposed to work. So again, that's 40 hours for full-time and 20 hours for half-time service. Time away includes holidays, continuing professional education, time that you take, vacation time, annual time, sick leave, and maternity leave that is less than 12 weeks. Or if, for instance, your site just closes, you will also have to count those as absences. So how do you submit this in-service verification that I speak of? It's completely electronic, and it needs to be completed in the customer service portal, which is why you need to set up a portal account if you do not currently have one. Typically, the verifications are released on the first day of the month after the verification time period end date and is usually requested from you every 6 months. I know that sounds complicated, but let me give you an example. If your first in-service verification spans from February 12, 2012 to August 11, 2012, that in-service verification will become available in the customer service portal on September 1st, 2012. So you will receive an email notification that the verification is due, so you don't have to continue to just log in to try to see if it's there. We will send you an email letting you know that it's there and ready for you to complete. So please, please, please don't ignore emails that you receive from the National Health Service Corps. And also, please ensure that there's a functional email address listed in your profile in the customer service portal so that we are sending the notices to the correct address. To access the in-service verification, you will need to log on to the customer service portal. Under your activities, and there's a screenshot there up on the presentation. Under your activities, you should see the verification that is due. You would click on that verification to open it, and then you would enter the time away from your site within the time period specified on that particular in-service verification. It will ask you a couple of other questions, including, is the assigned site correct? And on that in-service verification, you will also be able to say, no, this address is not correct for my service site. Time away should be entered in days, so the units is days that you can put in, and the system does accept fractions and decimals. So for instance, it will accept the 1.5 for 1.5 days away from your site. Once you have entered the information requested of you, you will submit it electronically through the portal. The verification then electronically goes directly to your assigned site's point of contact, and they should also have a portal account and sign up for a portal account. And one thing to note here is that the National Health Service Corps point of contact may be different from your immediate supervisor, so you should be aware of this and try to identify who your point of contact is at your particular site, because they are the ones who are going to be verifying your time. Once your site's point of contact has reviewed what you have submitted, they may either reject it, in which case it comes back to your portal account. You must then correct it and then send it back to them via the portal. Or they may approve it, and this would mark your verification complete. To reiterate, completion of the verification is completely electronic, and it's a two-step process. Both you and your site must enter information in order for it to be deemed complete. You will continue to receive email notifications about the verification until it is completed by both you and your site. If you have done your portion of the verification and you continue to receive email notification, that means that your site probably has not completed their portion of the verification. So your first order of business is to contact your site's National Health Service Corps point of contact to see if and why they have not completed it. It is imperative that you submit your in-service verifications on time. If you do not, this makes you non-compliant and you can risk being put into default. But I know that won't be anyone on this webinar. So now I'll talk to you a little bit about submitting service requests. As mentioned previously, you will be able to submit service requests through the customer service portal, another reason why it's so important. If there's anything that you need to change about your current commitment, typically this is initiated through a service request. So this includes if you want to add additional sites to your site assignment, moving to another site within your organization, or move to another site within your organization. So many times organizations have a network of sites, and they may need you to move on a permanent basis, or they may need to split your time between sites on a permanent basis. While the National Health Service Corps cannot interfere in the business decisions that the sites have to make, we do need to have it on record that you have been asked to move to another site, and it is at the discretion of the National Health Service Corps to give you credit towards your service obligation to work at those sites. And the reason for this is we need to ensure that the sites you are going to are actually National Health Service Corps approved sites. The misconception is if one site in a network is National Health Service Corps approved, then they all are, and this is not true in all cases. Therefore, it is imperative that you contact the National Health Service Corps and get written approval from us before you move to another site. There may also be a situation where you may need to transfer to another National Health Service Corps approved site outside of your current site. Maybe, your spouse is being transferred to another state for job-related purposes, and you need to also transfer your job. You may need to transfer to another National Health Service Corps site in order to complete your obligation. You must submit a formal transfer service request through the portal for this kind of service request. And here are the important things that you need to determine as you put in a request to add sites or be reassigned or transfer sites. If you're awarded at a site with a HPSA score in your discipline of 14 or above, you need to transfer to another site with a HPSA score in your discipline at a 14 or above. And these are for new applicants for the 2012 cycle. Another type of service request is a suspension request. You may need to request a suspension due to a medical emergency or a personal emergency that will result in an extended period of absence. Please keep in mind that all suspension requests are not guaranteed. Also, if you are granted a suspension, your service end date will be extended accordingly for your time you were out on suspension. In all cases of service requests, the National Health Service Corps will ask for certain documents to be completed and sent to us for review. The sooner you get the documents to us, the sooner we can review your request. Service requests can take 30 to 60 days, sometimes more, to review and get a final determination. So please keep this in mind as you plan. Please be advised that if for any reason you are not working at your National Health Service Corps assigned site at any time, you are out of compliance and you may be recommended for default. This includes if you leave your site without prior written approval from the National Health Service Corps, if you lose your license or your license becomes restricted or encumbered, if you get terminated from your site, if you resign or refuse to renew your employment contract, whereas you wouldn't be able to finish out your service obligation, or if you refuse to accept a site assignment from the National Health Service Corps, if you're not working full-time or if you're not working part-time as per your National Health Service contract terms, the list goes on here, and hopefully you would never find yourself in those situations where you would be facing default, but it does happen. And we do understand at the National Health Service Corps that circumstances may present themselves that are sometimes unfortunate or out of your control. What we ask you is just to keep the lines of communication open so that we can document what is happening with your case, what is happening with you. The worst thing you can do is fall off the face of the earth and not call us and not contact us to let us know what's happening. We can figure out with you the path forward if you keep us aware of what is happening. So half-time conversions is another kind of service request. There may be a circumstance where you may need to convert from full-time to half-time service. So once you request to be converted from full-time to half-time service and you are approved to do that, you will not be allowed to return to full-time service within that service obligation period. If you switch to half-time service, your remaining service time will be doubled. For instance, if you have 200 days remaining on your full-time contract and you switch to half-time, you will have to provide 400 days of half-time service. Those working under a private practice option or PPO agreement are not eligible to convert to half-time service. Additionally, if you are currently half-time, you cannot switch to full-time service. In order to request a conversion, you must contact the National Health Service Corps. First, you must get approval from your site that they are allowing you to go from full-time to half-time service. And the National Health Service Corps will request confirmation in writing from your site. You must be in good standing with the National Health Service Corps, and that means making sure your in-service verifications are up to date, making sure you've been in contact with us about converting your service, and that you are actually serving at the site that you've been awarded to serve at. And you must complete and submit a conversion request form and sign a half-time contract addendum to modify your original contract. You can access the forms in the web addresses here on the presentation. For those of you who don't have access to the presentation or who may just be listening in, the web address is http://partners/forms/index.html. Remember, the conversion request must first be approved by the National Health Service Corps before you can begin half-time service. Pending further questions at the end of this entire presentation, this concludes my portion of the presentation. And I'd really like to personally thank you all for your commitment to provide health care to the underserved populations in our nation. I do know that I just provided a lot of information, and it may be a lot to take in all at once. I see the chat line just has a lot of questions there, and I will definitely try to answer all of your questions at the end of the presentation. As mentioned earlier, all of the information that I just went over can be accessed on the following website. It is http://nhsc.hrsa, that's HRSA.gov/LRPPLICATIONE.PDF. I will now turn the presentation over to my colleague, Habiba Lomax.
Good evening, everyone, and welcome. As Aisha and Diane has already stated, I am here from the Loan Repayment Branch, and what we do here is we make sure that you stay in the program. You're happy with your site, and you have more loans that you would like to get rid of, and we want to make sure that we help you do that. So if you decide to stay at your site or move to another NHSC site upon approval, here's what we can do to help you. First, what is a continuation contract? A continuation contract is a one-year extension of your current NHSC LRP contract to serve at your NHSC-approved site of record from the end of your last contract, which is normally your first original 2-year contract, or if you've already completed that and you did one continuation, you can continue on until you basically have all of your loans paid off. NHSC providers are awarded additional funds to further reduce their outstanding educational debt that was previously approved by NHSC. So basically, your loans that you submitted when you first started your original contract is what we approve, and until those loans are, you can continue to go through the program until those loans are paid off. You can add additional loans, however, they had to have been obtained before you entered the program. So you cannot add any new loans that you obtained while you started the program. Continuation applications are assessed against the program guidelines that are in place for the fiscal year. Our fiscal year runs from October 1st to September 30th, for which you will begin your extended service. Award levels are dependent upon the most current award schedule that is in place at the time you are eligible. Please make sure from fiscal year to fiscal year you read that current guidance, because information, numbers, amounts, award amounts, things can change from year to year. So you want to make sure you read the most current guidance for that fiscal year. Whether your service will be executed in full or half-time status. How to apply for a continuation contract. This is something new for our fiscal year 2013, where we have implemented a deadline to apply for a continuation. Eligible participants must complete applications during your designated application cycle. The application cycle for each participant is based on your official service end date at the time you are eligible. So again, this information can change from year to year, so you must check your guidance so you can see what time is for you to apply. So for example, if your end date was to fall between September 30th, 2012 and December 30th, 2012, you can apply anywhere from July 1st, 2012 to October 18th, and so on. Once the application cycle is open, the continuation application all access link to complete and submit your application will be live by logging into your customer service portal. So in your portal, you'll see apply now for a continuation. You will also receive an email at least 30 days prior to that time to remind you that within 30 days you will be eligible to apply for a continuation. Applications submitted after the deadline will not be considered. Participants will not have the opportunity to submit an application during a subsequent continuation application cycle. So again, make sure you check the scheduled time for you to apply prior to, when the application guidance comes out for that fiscal year, because you want to make sure you do not miss that opportunity to apply for a continuation if you still have loans that you need to pay. Before you apply for a continuation contract, there are some things that you need to make sure that are in place and you have done your due diligence to take care of. As Aisha mentioned, your service requests and in-service verifications are very, very important to maintain and keep up, because this can also affect if you receive a continuation or not. If you have any service requests outstanding, requests for transfers, reassignments, suspensions, and they are pending and have not been completed, you will not be eligible for a continuation. Requests for conversions to half-time should be made and approved prior to beginning to work on a part-time basis. This can also prevent you from receiving a continuation. If you and your employer transition you to work on a part-time basis prior to submitting a conversion request and prior to it being approved, you will be out of compliance, thus not eligible for a continuation. Now, I will say, if you wish to convert from full to half-time, you can do that at the time of your continuation, but your original contract has to be completed. So you cannot do it before without requesting a conversion. However, if you wish to apply for a continuation and you want to change from full to half-time, you may do so at the time of your continuation application. Transfers and reassignments that are submitted and or processed after the current contract end date will prevent you from submitting an eligible continuation application. In-service verifications. To remain eligible for a continuation contract, all in-service verifications must be submitted to the on-time and consistently throughout your NHSC service period. So you must make sure, again, as Aisha stated, that you check your portal for your verification forms and they are submitted in a timely manner. You have your site submit them in a timely manner, because this can prevent you from, again, receiving a continuation award. Anything that's not submitted before the end of your contract end date can prevent you from, again, receiving an award, and you don't want something small like that to happen. A note, before transferring, moving to a different site, or reassigning participants, NHSC must, again, approve this, which Aisha has iterated to you, and you want to make sure that you're letting us know these things, again, because it can affect your receiving an award. Also, before you apply for a contract, continuation contract, you want to make sure that through the portal, you verify and update all your contact information. Sometimes we get married and things like that, names change, phone numbers change, and that can affect when you apply for your continuation. If information doesn't match or we need to contact you, you can also miss out. You want to read and understand the program guidance. I cannot stress this more, again, because the guidance can change from fiscal year to fiscal year. So you want to make sure that you read and you understand all parts that pertain to your discipline and specialty, as well as the service, in-service part, and the applying for a continuation. View all application and tutorials. Gather the required documents prior to submitting your application, because you want to make sure that you have all of this information before you apply, because again, if you're trying to do it at the last minute and you don't have everything, that can prevent you from receiving an award. You want to click on the link to complete and submit your application, and then you begin the process. After verifying that your application is complete, a program analyst will contact you to provide one-on-one assistance. This analyst will take you from start to finish of the application. If you have any questions, you have any updates, you want to know what's going on with the application, your analyst will be there to provide that, as well as the portal. The portal will update you each step as your application moves from one part of the process to the next. The portal will give you updated information. If you need support, again, Aisha gave you our the NHSC website. You can contact us there. The best way is through the portal. Submit all of your questions. We'll get back to you within the 2-day time frame, and we'll be able to answer your questions in a more timely manner. Eligibility requirements. Applying for a continuation contract requires the same criteria as the NHSC loan repayment program. Before applying, be sure to do the following. Now, I don't want to scare you. It's not as lengthy as it is when you first started the program. However, we do need to make sure that some things are still in place when you did originally apply. So you must remain at the site of record. We will verify that your site is still an NHSC approved site. You want to work with your site administrator to recertify your site on time. Clinicians don't know that there is, with some sites, they can expire, and you want to make sure that you're not waiting to the last minute to have that site recertified when it's time for you to apply for a continuation. If your site loses its NHSC approved status and it is not recertified prior to submitting your application, you will not be eligible to apply. You want to review the most current NHSC LRP service guidelines. The NHSC publishes a new program guidance annually. This guidance is normally published by October 1st, which is the first day of our fiscal year, and it will have all the updates, changes based on your input and recommendations made by the public health community. You want to understand your health professional shortage areas, which is also known as a HPSA. You want to verify that your HPSA data is up to date according to your discipline and specialty, because a site can still be approved and have a mental health HPSA, and you could be a dentist, and it may not have a dental HPSA, which means you would not be eligible to apply. So you want to make sure that your HPSA is designated for your site. And again, if your site loses its HPSA designation and is not redesignated at the time you attempt to submit your application cannot be processed. NHSC providers must meet all eligibility criteria as stated in the program guidance for the year you will begin to extend your service. The most current versions of the following documentation is required. So currently, when you go to apply for a continuation, we're going to ask you for some information. We want to see your updated lender statements for the loans that we originally approved, a disbursement report, and or an NSLDS 8 summary report. And again, these were things that you originally submitted. They're very easily obtainable, and you just upload them straight through the portal. We want to also have you to complete an employment verification form. The employment verification form will be completed by you and your site administrator or CEO and signed off by your site administrator and or CEO. All service requests for transfers, reassignments, suspensions, and conversions to full or half-time must be made and resolved prior to submitting your application. Sorry to be redundant, but again, this information is very important. You want to make sure that you're in compliance, because if you want to continue to serve and get those loans paid off, all of this information must be updated. Proof of payment. This is also very important. Verification that all dispersed NHSC award funds were applied to the educational loans that were previously approved by the NHSC Loan Repayment Program. So the funds that you received you must show proof that those funds were applied to the loans that we approved. You cannot have applied them to loans that we did not approve, or that will make you ineligible. So one, they must be submitted by all NHSC participants, regardless of whether the service was completed in the recent or distant past. So if you do not come in for a continuation and you decide to come back 3 or 4 years as a new applicant, if you were a participant in previous years, you will still need to show proof of payment. Payments should total the total award amount that you received when you submit your continuation application. So if you apply, if your deadline to apply is 60 days before your end date, all funds, you must show proof that all funds have been paid. So you cannot say, well, you still want to have 2 months left to pay to total the whole $60K or $50K, whatever you received. You must show the full amount at the time of application. Participants who have used awarded funds to reduce the balances of loans that were not approved by the NHSC are not eligible for a continuation contract or any other BCRS programs in the future. these are some important reminders that I just want to go over again. And again, I'm sorry to sound like I'm just continuing to repeat myself with the same things over, but these are very important points because especially if you are applying for a continuation and you want to get additional funds, it's very important to remember certain things. So again, participants apply during their open application cycle only, review the most current NHSC LRP service guidelines. The NHSC publishes a new program guidance annually with updates and changes based on your input and recommendations made by the public health community. So we do get your input when we're putting this guidance together and making sure that it suits you and best fits you, because you all are the ones out there on the front line. So we want to make sure that everything is conducive to your working environment. Continuation contracts take effect once your current contract is completed. NHSC LRP award funds are not taxed by the federal government. Make sure you consult your tax professional for answers to guidelines in your state. Apply for a continuation every year until you no longer have eligible student loans with outstanding balances. The NHSC fiscal year runs again from October 1 through September 30th of the next year. Time away from service may extend service beyond a fiscal year. And I believe Aisha also explained that. So if you were due to receive an award, your end date is in 2012, however you went past, and that pushes you over to 2013, you're still eligible to apply for a continuation, but it'll just be that next fiscal year, so it'll be as if you kind of missed a year. So again, as Aisha stated, I also would like to thank you for your service, and thank you and congratulations to you, and welcome you to the National Health Service Corps, and I will now turn it over to Gary Halady.
Okay, thanks. Hi, I am Gary Halady. I am the Regional Supervisor for the Bureau of Clinician Recruitment and Service. For Region 9, this map here shows that we have 10 regional offices, and in the next few slides I'm going to summarize very briefly what we do in relation to the National Health Service Corps. One of our main activities is that we actually get out on the ground and visit National Health Service Corps sites and providers. There are approximately 14,000 approved sites around the country, and we have only 10 offices in the field, so we're not able to get around to visit everyone every year, but we try to get to visit every site at least once every 3 years. When we do visit, we meet separately with the site administration and with the National Health Service Corps providers. With the site administrators, we review their compliance with the National Health Service Corps program requirements, and then we meet separately and confidentially with the National Health Service Corps clinicians on site to talk with you all about the program requirements, any updates in the programs. We talk with you about any concerns that you may have about your work or the site. And then we submit a summary of our visit to the site administrator that would include any issues that need to be addressed in order for the site to remain in compliance with the program and to assure that you all are provided sufficient opportunity to meet your service requirements. We are also responsible for reviewing and approving new site applications, as well as site recertifications. Each site is supposed to be recertified once every 3 years. The recertification and the new site approval does not necessarily require a site visit, but sometimes it does. In particular, any private practice site that is submitting for a new site approval must have a site visit before that approval can be granted. Finally, we work with scholars and loan repayers to help with site placement. Scholars, they need to find a suitable site prior to completing their training. We work with them to help identify options and help them sort it out and get their paperwork in. Now, for you loan repayers, we usually get involved when, for one reason or another, you're looking for someplace else to go. You want to transfer. And we help steer you in the right direction to find what sites may be eligible for your continued service in areas that you're interested in. Finally, we do get out and promote the program in various settings. We're always happy for invitations if you all are involved with activities where there's an opportunity for someone to come talk about National Health Service Corps and our programs. We're happy to do that and encourage you all to let us know when those kind of opportunities come up. This is a list of the regional supervisors. Each one of us has a staff of analysts that we work with that have particular expertise for each state. So we're available when you need us for these issues that I just described, and also if for one reason or another you may get frustrated or confused with any aspect of the program, we're a good reference source, and we can help you find your way through the processes to get where you want to go. So I think that's all that I had to say, and I'll turn it back to Diane.
Thank you, Gary, and thank you, Aisha, and thank you, Habiba. As you can see on the screen, we have information on how you can contact us. It can be by phone, by fax, by email, or through our website, and of course, always through our portal, which is a very good tool that, as we've said, is available to you 24 hours. And then we have additional available resources. I think I've seen some of the questions coming up through the chat that relate to some of these resources, including the health professional shortage areas, applications, job opportunities, which is our new job center site, and Office of Personnel Management, and some of the links to some of our partner state primary care offices, information on cultural competency, and other funding sources and professional associations. Finally, we want to welcome you to the National Health Service Corps because you are the Corps. You are one of over 40,000 caring providers who have served as members of the Corps, and many of our NHSC members have chosen to remain at their sites long after their service commitment is completed, and we hope that you'll be one of those as well. Now that you're a member of a distinguished program that brings high-quality health care to communities and people without access to health care services, we hope that you'll be able to stay with us and continue to bring in others who may be involved in helping those who are in underserved communities. I'm going to turn this over to our operator for a moment to see if there are any questions that are on the phone line. We do have several questions that we see in the chat line. I believe Aisha has answered some. I have answered some, and we will continue to go back now, take a pause, and read through those that we may not have gotten to. And while we do that, if there's anyone who is on the phone line who'd like to ask a question over the phone line, we'd like to take those questions now.
And at this time, to ask a question, please press *1 on your telephone keypad. Again, *1 for any questions. And you have a question from the line of Danielle.
This is Evgenia.
Yes.
I have a question. They didn't give me vacation last year, the full vacation. I just took two weeks vacation instead of 4 that I was eligible before July 1st. So they said, no problem, you're not going to lose anything, you can take this year. If I'm going to take it this year, that will be counted into 35 days, so it's going to be considered, if that's what I'm supposed to receive last year will not be counted in that 35 days.
So I'm going to ask Aisha to take that question.
Yes, this is Aisha. Yes, you will have to count that vacation time taken this year within the 35 days of your allowable absences. And the reason for this is that, as Diane explained earlier, your contract with your site or your personnel negotiations with your site are separate from your National Health Service Corps obligations. So, you know, I understand that they didn't allow you to take it last year, but for all intents and purposes, for your service obligation that you're serving with us, you do have to count those days as days away from your site. And as long as you're not going over your 35 allowable absences in a year, you should be okay. You're going to be okay either way. If you go over your 35 allowable absences within a service year, your contract end date will be extended accordingly, and that will be workday for workday. Did I answer your question?
You mean if I happen to be on vacation longer, then I will be working longer on the site? That's what you're saying?
If you are on vacation and within the service year that we are talking about, you have exceeded 35 absences, then time will be added on to the end of your contract. Yes.
But there is no any other punishment than that.
I would hope not.
All the time. I really like the place, so hopefully I'm going to stay. But so for me, it's not like a punishment. I would stay there anyway.
Yeah, you would count.
I just want to know if there is any risky business if I actually take my vacation that I'm supposed to have.
Yeah, I mean, when you get into situations where, you know, again, we can't get involved in, you know, site and employee issues. We certainly don't want you to have excessive absences because in that case, some sites may terminate you for that reason. You know, we don't want you to go back to your site and say, well, the National Health Service Corps said I can take my vacation and nothing happens to me. You know, so, you know, it's a delicate balance that you have.
Before I even consider anything like that.
Yeah, you have to weigh it out.
Thank you, Aisha. We appreciate you taking the question.
There was one more question.
Yeah.
Yes.
It's about everyone probably want to know. How is the organization going to have a portal the same as we do? How they already have a portal? It's officially established with you guys, or we somehow have to introduce them to this?
Your site point of contact would need to go onto the website that I mentioned, and they would have to go to I am a site administrator link, and they would have to register in the portal. So they would have a separate portal account from you.
Got it.
Did you get that answer? Does that help you?
So if there is a site administrator link, does it show under our portal, or when they enter, because we all have our access, we have our ID number, or I mean, the password, they don't. So how are they going to?
You would not have access to their portal account. What happens when they set up a portal account, they're setting it up with their UDS number and their email address. So as long as they are set up as the point of contact within our system, it will link all of the positions that are at their site, all of the National Health Service Corps participants who are assigned to that site will come up under their portal account, and that's how they will see which verifications are due, and that's how they will complete your verifications.
Thank you, Aisha. I'm going to have to ask that we move on to the next set of questions that may be online. We also have a few that are holding on the conference call. So I'm going to ask a question that came in early from the online chat, and then we'll go back to the call-in. There is a question, does a psych nurse practitioner fall under the mental health guidelines of 21 hours on-site direct clinical?
And I answered that question on a chat. So the psych nurse practitioner is considered a psychiatric nurse specialist. So yes, they will be under the same guidelines.
All right. Let's go back to the online calls. Are there any other calls through the audio portion?
Yes, you have a question from Quandra Whaley.
Oh, yes. I have a question. So if I refinance my student loan and is now lower than what I originally submitted, what happens with the funds?
Quandra, could you turn down the sound on your computer, please?
Okay. I'll see. Okay.
Okay, we can hear you better now. Thank you.
So if I refinance them in the process when I applied for the loan and now it is lower than the amount of what was given, like I could actually pay it off and there would be money left?
This is Habiba. I just want to make sure I'm understanding what you're saying. Are you asking?
Because what I did was I got them all combined to one thing, and so when I refinanced it, after I submitted it to you guys, it's now lower than what was originally submitted. So I got actually more money than what I actually owe on student loans.
Okay.
So that's a crazy one. I know.
How did they waive or take,
the interest off?
Okay, so they took the interest off. So basically, you have more fund. We sent you more money than what your payoff is.
Yes.
Okay. So I would suggest maybe we would need to talk offline because that you would have to do something with that additional money.
Okay.
So I can give you my email address.
Okay.
Habiba, is it possible for her to put that through the customer service portal?
That would be wonderful.
Then she could give more specific details.
Exactly. If we could give her the details, right, because exactly.
Okay.
That's the best way to go, Quandra. If you also, and in your customer service request, you could actually say, I spoke to Habiba Lomax, and maybe you could have them circulate it to her directly.
Okay. Got it.
Thank you.
Okay, thanks. Are there any other calls to the audio portion?
Currently, there are no other questions in queue.
Okay, let's take some of the questions that I see coming through. I know Aisha has been answering several of them. The most recent one I see is if I am scheduled to see 20 clients a week for a total of 20 hours, but I have 2 clients cancel their therapy session, do I only get credit for 18 hours for that week? Aisha?
The answer is unfortunately yes. You would have to count if you're half-time and you're not making the 20 hours a week, any time spent not providing direct patient care or doing some of the other activities is going to have to be counted as time away. Does that answer the question? You can say it on the chat line if you want to.
If it does, please let us know. I believe they said yes, it does.
Okay.
Okay, I think there have been several questions, again, which Habiba referenced around if my portion of loan repayment is less than what I received the actual amount for, what do I do? So I do think, Habiba, do you want them to put those questions through the customer service portal?
Yes, submit a service request through the portal and we'll handle it on the case-by-case basis because we need to find out or decide, look at each case different.
Let's see. Okay, Aisha, I see there are some questions around no-shows. Because they don't have control over no-shows. So what do they do in that case? If they are, I guess, mental health specialists, if you could say that you are a mental health specialist, let us know. No, some of them are in primary care.
Yeah, I mean, this is a common question that we get all the time, and, you know, unfortunately, there's no trick or good answer that I can provide you. If you are not meeting those hours as specified during my presentation, then you would have to count that time as time away from your site. And I know it happens all the time, the no-shows. We get this question all the time, but that time does have to be counted as time away.
Okay, let's go back to the call-in line. Operator, are there any others waiting in the queue?
Currently, there are no questions.
Okay, I have a question here. I'm working full-time in family medicine. Do I have to keep track of how many patients I see? Do I have to worry about keeping track of no-shows?
What I would answer that question that you should keep the most meticulous records around your service time. And the reason I say that is because we have had a few cases where LRP participant put in number of days missed, a number of days missed away from their site, and they send it on to their site administrator or site point of contact, and site point of contact is saying, no, you didn't miss that many days, you missed this many days. So, you know, it behooves you to take, to track your patient hours and to have a record of that so that you have something to show to your site in case there's a disagreement. And, you know, again, the National Health Service Corps can't get in the middle of those kinds of disagreements. We really would like the participant and the site to really hash out the days away. What we could provide you is guidance on what does count as days away or time away and what does not.
Okay. Let's see.
I saw another question about if your point of contact is no longer at the site. You should let us know about that immediately. Technically, the site is really supposed to let us know about that so that we can identify another point of contact. Sometimes that does not happen, so it ends up where the participant is the person who's letting us know because they need to submit an in-service verification, and there's no one on the site side able to verify it or identify to verify it. So if that comes up, definitely pose a question through the customer service portal, being specific about not knowing whether there's another point of contact or giving someone else's name who may know another point of contact as well as their phone number or email address if you can. So put a question in through this customer service portal and we will try to track down another point of contact. And Gary might have some other ideas because he works in the regions about the points of contact and how we get those points of contact updated in our system.
Yeah, another way to do it would be to just give us a call and we can enter points of contact directly into the system on the phone call.
We have a question here, Habiba. This one says, how do we handle the payment to our loan company? Do we make one lump sum payment or pay interest and principal monthly? If we only make monthly payments, how can we pay down the loans of the award? We have several questions related to that. If you could address that, that would be helpful.
Yeah, the best way is to make the lump sum payment, which would and then provide us proof that that payment was paid. However, we can't control what your lender requires you to do as far as interest and principal. If they require you to make monthly payments, then you can do that as well. However, the completed award amount has to be paid, again, within your 2-year contract, or if you're going to apply for a continuation, it must be paid by your continuation application date. Some lenders will let you make a lump sum, and then you don't have to make any more payments, but some still will require a monthly payment even if you make a lump sum. So that is something that you would definitely have to work out with your lender.
Thank you. I'm going to answer one of the questions that is online through our chat. It is asking if there will be a conference this year or if they can attend a conference. This year we're hosting webinars. This is one of our first webinars, and it's going to be recorded, and it will be housed on our website at a later date. But yes, we will be holding webinars for the rest of this year. and hopefully if you would like to join another one, you will have that opportunity. You'll get an announcement via email and announcements on our Facebook and on Twitter so that you can see when we're going to hold the next one. I understand there are some people who may be on hold through the phone line. Operator?
Yes, you have a question from Danielle.
Hi, Danielle. Hello?
Maybe it's not Danielle, it's Evgenia again.
Okay. Go on.
It's again back to the portal. The employee has to use the same website, www.nhsc.hrsa.gov, to go to the INA site administration and open the portal.
So in order for your site administrator to get into their site portal, yes, they can go to that website, which is our website, and then they can click on sites, and then there will be instructions from there to get into their, or to create their portal access.
Got it. Thanks.
You're welcome. Are there any other calls?
Yes, you have a question from Sonia.
Hi, Sonia.
Hi, yes. I am in the mental health field, and so I have a question. I'm a full-time participant, and I know of the full-time hours. I have to see 21 patients, which that's never a problem. The question is of those 40 hours, I know there's 8 hours that are considered to be like clinical service. I guess that's like doing that progress notes and things like that. Of those 8 hours, like in my schedule, can I block out, up to 8 hours where I'm allowing myself time to do that and not see patients during that time? Or is that something that I have to complete out, make sure that I'm booking patients all the 40 hours, and then the remainder of the time I'm doing those progress notes kind of at home? And are those counted towards the 40 hours?
Hi, this is Aisha. The way you organize your schedule is really completely up to you and your site. So I don't want to steer you in one direction and your site says, no, we're booking you for 40 hours and that's it. So it's really up to negotiating with your site about that. Does that answer your question?
Yes. Okay, I guess my additional question to that is, let's say in a week I do meet 21 hours, but the remainder of the time, there was either no shows or I'm doing additional things like making phone calls or doing CPS reports or doing other things. So long as I'm doing other things at the site that is pertaining to my clients, that's counting towards my hours at the site in that 40-hour week. Is that correct?
So long as the additional activities that you are doing is not exceeding the 8 hours of teaching or the 8 hours of teaching and admin combined. Does that make sense?
No, say that again.
Okay, so you said that you would be doing other things within the 19 hours, but within those 19 hours, you cannot go above 8 hours for teaching and admin activities combined.
Okay, so what is considered, let's say I see 30 patients and I'm doing 8 hours of admin. Those additional, 2-3 hours, what would that be considered? Like just I would be makeup time? Like I'm on site, but maybe I'm not necessarily doing admin, or I haven't seen a client because they no-showed.
Are you asking what are the hours considered that don't fit in the buckets of admin or clinical services or direct patient care?
Yes.
I don't have an answer for you for that because the categories we have are direct patient care, clinical services, practice-related administrative activities, and teaching activities. So maybe a more expanded definition of what each of one of those things means could help you. And so
yeah, I think that would be good.
I'm going to just ask you to pose a question through the customer service portal so that we can provide that to you.
Okay.
Okay.
Let's see, what else do we have here? Someone asked about their service period. I think it's been responded to, that they can check that in their profile in the customer service portal. And we have a question, do I need to do administration time or can I just do 20 hours of patient care? I am a part-time participant. Aisha?
I'm sorry, can you repeat that, Diane?
Do I need to do administration time or can I just do 20 hours of patient care? I am a part-time participant.
Yeah, administration time is, for National Health Service Corps purposes, is not a required thing, as well as teaching. So yes, you can do 20 hours of patient care.
I'm going to go to the call-in line. Do we have any questions on there from the
Yes, you have a question from Jessica.
Hi. I am a family practice PA, but I provide family practice services to mental health patients. So I'm kind of in the same boat I think a lot of the mental health providers are with the no-shows. With the 32 hours of the direct face-to-face time, we have patients scheduled for an hour. Sometimes it will go over, especially with the initial appointment. Do I just keep track of how long each appointment is to prove the 32 hours face-to-face? Or is it an average each week, or is it just going off of what I have on my schedule?
Again, the way that you count it and the way you and your site work it out is like between you and your site. What I would do if I were you is try to track it as close possible. I would not rely on an estimate, to be honest with you, just because you just never know, what your site may say or how they might, if they might reject your in-service verification. So, how meticulous you are with tracking is really up to you. It's really up to your personal style.
Okay. And then with the no-shows, I will have Sundays, especially when it rains, because I have a lot of patients that walk to our clinic, that my entire day will just not show up. We get a lot of rain on the shore, so is this something that may eventually cause me to have to, like if I end up over the course of the year not having that direct face-to-face 32 hours, more than those, and it extends past those 7 weeks that we can take off, will that automatically just extend the contract out or extend my service agreement out, or do I need to do something else so I don't get into default for not having my time in?
So currently we are chatting internally about the no-shows, that question that has come up, and I believe one thing, and our regional offices believe another thing, and I want to get more clarification on that before we go down the road of answering the question of no-shows. Diane, will we be able to send out like a mass email after the call about clarification with no-shows?
We can do that to those who are on this particular webinar. We can.
Okay, that's perfect.
Okay.
But to answer your question about any time that falls short of, I'm sorry, I didn't pick up if you were full-time or part-time, but anytime.
I'm full-time.
Full-time. Anytime that falls short of that 40 hours, then you would count it as time away. But again, we want to clarify the no-shows issue for you before we continue to answer questions about it.
Okay, great. Thank you.
Mm-hmm.
Okay, just again, we'll clarify that if you are on this webinar with us, we will be able to send out that information probably later on in the week. Are there any other questions from the operator?
Currently, there are no other questions in queue.
We did have a question about what the person I think is referencing as a disproportionate share hospital. and whether that was considered a critical access hospital. I will have to say that I am not certain.
It is. It is.
It is?
Yes.
That was from Jamie, so the response is, the answer is yes.
It is, but with any situation where you are questioning whether a site is one thing or another, I would definitely encourage you to pose a question through the customer service portal just so that we can verify that. But typically in the cases of critical access hospitals, they will also know if they're, a disproportionate share hospital, they will also know if they're a critical access facility. So you can ask them, but you can also try to verify with us as well.
We have another question here, Aisha. Are satellite clinics of FQHCs automatically an approved site if we work at the main site?
Gary would be best to answer that question.
Gary?
Yeah, satellites of FQHCs are automatically approved as National Health Service Corps sites.
So if that person is actually working at a satellite site and the main site, that would need to make sure that it was within their scope of what they've agreed to practice at for the National Health Service Corps. So we have that information that you are at.
Well, yeah, the satellite needs to be within scope of their grant as a federally qualified health center. So it's always good if you're going to be assigned to a new satellite site to confirm with us that it is approved.
Thank you. We have a follow-up question. Can we talk a little bit about what to do for maternity leave? I'm not sure what that means, but if you'd like to come onto the call line and clarify that, that would be fine. I don't know if we have any others on the call line.
Again, press star 1 for any questions. And you have no questions currently.
I see a question that's coming up on the chat line asking about a verification form. We no longer use a form, and it's done completely online now. And the questions that are on the form, I know a lot of you are anticipating, well, what does this form look like, or what does it look like? What are we going to be asked? It's going to ask you how many days away from your site how many days you spent away from your site, basically how many days you were absent within the 6-month period, or whatever the time verification is on the in-service verification. It's also going to ask you if your practice site address is correct, or your practice site is correct. And it's also going to ask you whether you performed services as per the clinical service definition that we all talked about earlier about your minimum hours. So those are the 3 questions. It's a very basic form, and those are the 3 questions that are going to be asked of you. Not going to ask for a breakdown of your direct patient care, and then of your teaching, and then of your admin activities, if there were any.
I see that we also have some questions regarding notification via email about the payment disbursement, or just continue to check bank accounts for purposes of the entire group. Habiba, do you mind answering that question, please?
No. Can you repeat the last part? I didn't hear.
Are we notified via email about the payment disbursement, or should we just continue to check our bank accounts?
Okay. Typically, I would say yes, check your bank accounts. However, funds are normally dispersed approximately 90 days after your start date. So if your start date was in August, you can expect your funding no later than the end of November. So you will not receive an email or anything, letting you know that the funds have been sent out. But again, you can I would start checking your bank account in 90 days after whatever your start date is.
Okay. We're at about 8:40. We are going to give this 5 more minutes so that we can try and answer as many questions as possible. If anyone would like to have a question answered, please go through the call-in operator or type in your question. We hope to get to it. And if not, we do encourage you to put your questions through to our customer service portal. It's very important that you use that accessible tool. It is available to you at any time. So So if we're not able to get to your question this evening, we do encourage you to put that question through to the customer service portal, and you will get a response within a 24-hour to 48-hour period. Let's see, do we have anyone on the call?
Yes, you have a question from Alex.
It's actually funny. Once I put in that I had a question, you answered it, so I think I'm taken care of.
Okay, thank you.
You also have a question from Jeannie.
Hello. Can you guys hear me?
Yes. Yes, we can
Oh,
hear.
okay. I just had a question about maternity leave. If it's, I plan to usually take 12 weeks during maternity leave. Do I need to report that before I leave for maternity leave, or just put it on my 6-month verification as far as hours away from the site, or how does that work?
It really depends on the state you're in and how much time they usually allow for maternity leave. But I'm assuming in your case, because you're saying 12 weeks, that it's 12 weeks. So
yeah, for FMLA, it's 12 weeks.
Okay, so if it's 12 weeks and under, you would put in an inquiry through the customer service portal and say, hey, I'm going to be on maternity leave, and give us the dates that you're going to be on maternity leave. You would also have to provide a letter from your doctor letting us know that you will be on maternity leave, and we will just put it in your file so that we know that you're on maternity leave, and then you would count those days away from maternity leave on your in-service verification. And sometimes your maternity leave might span 2 verifications, so you have to make sure you account for all of that time that you were away from your site. Once you're back at your site, we will ask that you submit a letter from your site saying that you are back at your site in the day that you began back.
We are going to put up the evaluation. I hope that you all will be able to check the responses there. We want to make sure we can provide more webinars and make them as informative as possible. We can still leave up the chat. You can still connect through that. And while we're getting up the evaluations, if there are any other calls on the call arm, we will take operator. Are there any calls coming in through the call line, operator?
No, you have no questions at this time.
Okay. We are trying to make sure we get this placed up here so that as many of you as possible can actually respond to our evaluation. So if you do have a question at this time, it might be best to put it through the call line. Operator, could you provide them how they should do that again, please?
Yes, you just press *1. And currently there are no other questions.
All right. Well, at this time, I will ask you to please respond to our evaluations that are coming up. We do hope that this has been useful to you and helpful to you in terms of communicating with us and also in terms of moving through your service requirements. We will host another webinar coming up, and we'll be posting that on Facebook and contacting you via email. So if you have questions that have not been answered now, we really encourage you to please send that to the customer service portal. We'll be able to keep up the chat for about another 5 minutes or so. So if there are questions there, please put them through. I don't know if, Aisha, you have any comments you'd like to make as closing and wrap up?
I just, on the chat, put the link to the application, fiscal year 2012 application and program guidance. Many people have more questions about the hours requirement, and it's all outlined in the program guidance. So I'm hoping that you guys can access that link.
All right. Again, we're going to try and keep the chat going for a little bit, but we will definitely ask that you complete the answers to these questions for your colleagues, and I'll give it about 5 more minutes on the chat line, and then we will be able to shut down and just leave up the questions for you to answer. So if there are any more questions through the call-in, this is the time to ask, or if there's anything else through the chat, this would be the time to post that now.
Yeah, and Diane, I'd just like to remind everyone to get familiar with our website for National Health Service Corps. There's a wealth of information there. All these program guidelines, listings of approved National Health Service Corps sites, job openings, program requirements. It's all there. So it's a very useful resource, and I encourage you to get familiar with it.
Absolutely. Thank you, Gary. Habiba, any closing thoughts that you'd like to share?
No, again, I just want to reiterate to make sure that you read the guidance that pertains to your current year when you come in for a continuation. And if you have any questions, as Diane has stated, put them through the portal and we'll get back to you with answers to all your questions and making sure that, you know, this is a great experience for you. Thank you.
Okay. Well, I will say thank you all for participating. I want to thank our speakers for staying with us. We want to make sure that we provide you as much information as possible from the National Health Service Corps and want to be available to answer your questions. So again, we thank you for joining us this evening. We hope that you'll look forward to other webinars that we're going to produce for you through over the course of the next couple of months, and also that we ask you again, please use the customer service portal should you have questions or need assistance. It is available to you 24 hours. And on that note, I will say thank you and good night. We will now complete the online chat and also the conference call line. So thank you again for joining us. Thank you to the speakers.
This does conclude today's conference. You may now disconnect.